Hello everyone, I'm Dr. Geetika Thakur, working as a consultant in Obs and Gynae in Motherhood Chaitanya Hospital, Sector 44, Chandigarh. Today we'll be discussing birth trauma. As Birth Trauma Awareness Week is celebrated between 14th to 20th July. Now what is birth trauma? Birth trauma is a group of symptoms that you may experience after having a traumatic birth. Now what is a traumatic birth? Traumatic birth can be anything which caused distress to you during your delivery. It can be a traumatic forceps delivery. It can be an emergency cesarean which happened in the middle of labor. It can be a very quick labor. It can be a very prolonged labor. All sorts of things can make a birth traumatic. It can be a forceps delivery, which is using of instruments to take the baby out in the second stage of labor. It can be an emergency cesarean section. आपका लेबर अच्छे से चल रहा है, फिर किसी वजह से आपको अचानक से बोला जाता है कि अब सिजेरियन करना पड़ता है. That can also lead to a traumatic birth experience. Then a very prolonged labor, कि आप बहुत 12-24 घंटे तक आप लेबर में हो, डिलीवरी नहीं हो रही. That can lead to a traumatic birth experience. Otherwise, a quick and intense labor can also lead to a traumatic birth experience. Sometimes the patient wants pain relief, but it is not provided to them, either because of the medical condition or because the health professional is not comfortable with it. That can also lead to trauma because labor as it is very painful. Sometimes the health professional or your family for that matter does not provide as much support as you expected from them. That can also lead to a traumatic birth experience. If the pregnancy ends up in a complication like a postpartum hemorrhage or a preterm labor in which the baby has to be taken into the NICU and the baby is not shifted with you right away, that can also lead to certain trauma to the mother. All these things together or individually can lead to a traumatic birth experience. Now, how do we address this condition? First is addressing birth trauma. We have to address birth trauma by therapy. We should provide some kind of mental support to the patient who feels traumatic after the birth of a child. Secondly is support system. Support system comprises of the family members being supportive to whatever the patient is going through. It also involves the health professional being more involved with the mental condition of the patient and identifying that the patient has gone through something traumatic and then eventually giving them the support that they require. Third and the very important part is informed consent. Whatever is happening with the patient, an informed consent has to be taken. And be it as small as an internal examination or an instrumental delivery or patient being shifted for a cesarean section. कुछ भी प्रोसीजर करने से पहले पेशेंट के साथ डिस्कस किया होना चाहिए कि वो प्रोसीजर में क्या क्या किया जाएगा, किस तरह से आगे बढ़ा जाएगा और उसके क्या आउटकम्स होंगे. Then coming on to positive birth stories. People who have had positive birth experience should come forward and share their stories. This will bring about a positive attitude in the patients who've had a traumatic birth experience. Then coming on to self-care. Self-care is the most important thing. The patient has to identify that I've had a bad experience and how I have to get over it. Then last is patience. You have to be patient because it is not a matter of few days or months that your body and your mind will recover from a traumatic birth experience. So you should give yourself time. All this becomes important when the patient has to plan the next pregnancy because whatever the bad experience she's had in her previous pregnancy, it tends to affect her decision of having a second child. Now, how do we prevent birth trauma? First and foremost, and the most important part of this is open communication. As a healthcare professional, when you are discussing labor, delivery, cesarean with your patient, you have to be very clear about all the steps that are going to happen, all the situations in which an emergency cesarean has to be done. In case an instrumental delivery is required, what all is going to happen with the patient. It is very important that a patient is mentally prepared for whatever is going to happen during labor. Then is trauma-informed care. Yes, you have to identify the patient who has ended up in a traumatic birth experience, identify that she's going through some trouble and then start the management. Then is continuous support. Patient is in labor, the support has to be continuous. Right from the first visit when the patient comes to you, you have to be supportive to whatever she's going through. As simple as excessive vomiting in the first 3 months can be traumatic for the patient. So we have to be very patient and careful regarding her experiences and manage her accordingly. any symptom told by the pregnant patient should not be shunned by saying कि ये तो pregnancy में होता रहता है, ये तो हमें भी बहुत हुआ था. It's not like that. अगर patient को किसी चीज़ से problem है तो उसको सबसे पहले acknowledge करना है और फिर उसको treat करना है. Then of course if somebody has had a traumatic birth experience, she should be provided with proactive health management. So I would conclude by saying that discuss all the aspects of a delivery with your patient, be it normal delivery, cesarean, instrumental delivery, so that we all together can reduce the traumatic birth experience as much as possible. Thank you.